for some bonus content, I'm gonna share with you some special examination techniques that we use to examine the abdomen if we suspect certain pathology. So for example, if we suspect ascites, so your patient is lying supine, and what you would notice if the patient has ascites is that the flanks would be bulging and you'd have a protuberant abdomen. And the flanks will be bulging because when you lie down, the fluid moves to the side, to the flank, so the flanks would just protrude out, bulge out. So that's what you do by inspection. And then you move on into assessing if there's any shift in dullness. So what you do is the patient is lying supine, and so the umbilicus is here. You start there and you percuss to the side, and then to the flank region, and then you mark from where it changes from tympany to dullness, and then you do that repeatedly, and then down as well to the pelvic region, and then you do that to the other side as well. And then as you're marking where it changes from tympany to dullness, what you should get is like this U-shaped thing. It's because the fluid has moved from here to the flanks and downwards. Okay, so this would change from tympany to dullness, to the side and down. Okay. Also, what you could do is you can ask the patient to roll to the left, left decubitus position. So when the patient rolls to the left side, you could, I don't know if I could do it. So for instance, I'm like rolling towards my left side. This is my umbilicus. So you percuss down again, and then it's the same. You mark the area from where it changes from tympany to dullness. And what you should see is, because the fluid is pulling down, again, the dull sound would be concentrated this side, okay? And it would be tympanitic all of here because I'm lying on my left side. So that's what you should observe when you percuss an abdomen that has ascites, a patient with ascites. Another test we could do for ascites, to test for ascites, is called the fluid wave test. And for this, you would need the help of an assistant, or you could just ask the patient to help you. So what they need to do is put their hand kind of in the midline like this. And what this does, it stops the wave of transmission from propagating through the soft tissues. So I can't do this. I'm the patient and the doctor. So the patient puts their hand like this, or an assistant does it for you. It could just literally be that, to be honest. And then what you do is you tap lightly on the other side to propagate that wave. And the positive test would be you'd feel that impulse on the other side of the flank. So that is a positive test for ascites. We also have a couple of special tests for appendicitis. So there's 4 that I can think of. There's rebound tenderness, there is the psoas sign, rovsing sign, and the obturator sign. So rebound tenderness is basically you, press down 2 fingers in the McBurney's point. So McBurney's point is 1/3 of the distance from the anterior superior iliac spine to the umbilicus. So this line, you go 1/3 that distance, and that's the McBurney's point, which is the approximate location of the appendix. So you press down 2 fingers, and then usually when you press down, the patient doesn't feel any pain, but when you let go, like rapidly, so no pain, no pain, no pain, so as you let go, the patient would feel pain. So that is a positive sign, that's a positive rebound tenderness, which might then point to appendicitis. The next one is the psoas sign. So the psoas sign, again, the patient is lying down, supine position, they raise their leg, and you put your hand above the knee and ask the patient to stop you from pressing the leg down. So what this does is it activates the psoas muscle, and that irritates the inflamed appendix if the patient has appendicitis. So the positive result for this is obviously pain in the right lower quadrant. The next is the rovsing sign. So the rovsing sign is you press on the left lower quadrant, and the patient would feel pain on the right lower quadrant. So If the patient feels pain in the lower quadrant, then again, that is a positive sign. The last one is the obturator sign. So again, patient is lying supine, and what you do is you flex at the level at the hip and the knee. So it's hard to demonstrate. You flex at the hip and the knee, and then you internally rotate. You can't see what I'm doing. You can internally rotate at the hip, and again, a positive test would create pain or increase pain in the right lower quadrant. The last special test is for cholecystitis. So patient with cholecystitis usually presents with right upper quadrant pain because the gallbladder is located in the right upper quadrant. So you look for Murphy's sign. So basically what you do is you hook your fingers the costal angle, and you ask the patient to breathe, take in a deep breath, and the positive sign is sharp pain in that area and the abrupt cessation of inspiration or breathing, because when the patient is doing that, the edge of the gallbladder is going to slide down to meet your fingers, and that's painful. So that is a positive Murphy sign, which can be an indicator for cholecystitis.